pleased to have with us Dr. Paolo Casali from the National Tumor Institute, Milan, Italy. Thanks for spending a couple moments with us.
Thank you.
If you can, just give us an overview of your recent phase 2 study.
This is a phase 2 study on nilotinib in advanced GIST in first line. You know that imatinib is a standard treatment for advanced GIST in first line. It's a very successful drug. So the problem may be why we should have another drug. The limiting factor of imatinib is not so much the response rate, which is very high, but the progression-free survival, which on average is 2 years. So of course the hope with new drugs in this patient population for the future would be to have a longer progression-free survival, or if you like, a longer time to secondary resistance. So this is the rationale behind the use of new drugs, even in first line in advanced GIST.
You face some real challenges with this, don't you?
It's a challenge, of course.
Doctor, what has been the effect with wild-type GIST?
What we show in our poster is just some clinical observations, which should be viewed as very anecdotal. So what is interesting for a phase 2 study like this is just to have some tumor responses in different genotypes. So we showed a clear-cut response in an exon 11 GIST, which is the most frequent subgroup of GIST patients, and another tumor response, very convincing tumor response in a wild-type GIST. You know that imatinib is less active in wild-type GIST, so having so a convincing response in a wild-type GIST is encouraging. But then, of course, it will be the final analysis which will show how many of these patients respond and so on. I must say that a phase 3 trial is already ongoing, which compares nilotinib versus imatinib in the first line of the advanced disease in GIST. And I think that, I mean, we shouldn't see this kind of trials in GIST as a Pepsi versus Coke trial, so who is the winner? Inevitably, the results will be split at the end, and the main criterion will be the genotype. So what will be interesting is to see if nilotinib gives an advantage in some genotypes or in all genotypes and so on.
Doctor, thanks for stopping by and spending a couple minutes with us. Appreciate it.
Thank you so much.
Dr. Paolo Casali from the National Tumor Institute in Milan, Italy.